So first of all, on the arm, I'm going to go through the points, and this is so that you can practice them. So we've got a few additional points that are around the elbow mainly, and also a lung point in the forearm. Now what I want you to practice is finding the points. Once you're comfortable with them, you can just incorporate them in the Meridian massage work. So starting with triple heater, we've got triple heater 10, which is just above the cranial process here. There's a little dip. So often when the arm is flexed, it's easier to find. So we've got triple heater 10. Really good for expelling pathogens, so coming down with flus, colds, fevers. It's really good for tonsillitis and sore throats. Very good point for the moment. And then we come round, and we're joining this point. It comes round to triple heater 5. Remember, that's 4 finger widths, 3 sun above the wrist crease. So between the bones, we've got triple heater 5. So this point you will already know. But so we've got that comes down to triple heater 5, and then we've got 4 at the wrist, again really good for expelling pathogens, and then it comes off the ring finger at triple heater 1. So then we're moving on to small intestine, and again with the elbow flex, you'll see in between the cranium, and this is the medial condyle of the humerus, we've got small intestine 8. So small intestine 8's here, that's really good for things like any shoulder pain, shock, whiplash, those kind of issues. So once you find that, it's much easier again with the elbow slightly flexed. Then you move down and you're moving along the edge of the forearm, and then we come to our small intestine 4, small intestine 3, and then off the outside of the little finger. The next meridian we're moving to is large intestine, and large intestine 11 is at the corner of the cubital crease here. We've got large intestine 11 just where the kind of little crease ends, and as you bend the arm you can straighten it out, and then you're on large intestine 11. Now this point is really good for releasing emotions, letting go, abdominal pain. Also supports the respiratory system, but also for any pain through the arm. So carpal tunnel, tennis elbow, frozen shoulder, it's a really important point to work. Then 1 sun below that, we've got large intestine 10. So these are really important points for pain through this channel and releases the large intestine. That then comes down to 5, 4, 3, 2 and 1 here, and we've done those points already in the 5 element. So we're incorporating these new points here. Then we're moving to lung. So I'm just turning lung, being a yin meridian, turning onto the yin side of the arm. We've got on the lateral side of the cubical crease, we've got lung 5. So this is a really good releasing point for the lung meridian. So if people have got persistent cough, they've got a lot of phlegm, and we really need to release the chest, could also be emotional release, then this point is really releasing. And the next point on the lung is lung 6. Now quite handily you might notice that a lot of the points, some of the new points are 5 sun away from other locations or points. So that's easy for us to remember. So 3 sun is 4 finger widths, and then 2 thumb widths. So then we get to lung 6. This is another really good releasing point for any respiratory issues. So it's a really nice one to work. So we'll work down to that. Come down to lung 9 by the wrist crease, the transverse crease of the wrist, and that's a really tonifying point. So if the lungs are really weak, we're also going to work this point. Lung 10, lung 11 off the thumb. The next point we're going on to is the next yin meridian, which is heart protector. So on the cubital crease here, we've got in the centre heart protector 3. So this is a really nice calming point, again, good for emotional issues, but also really supports circulation and blood. So we've got heart protector 3, and coming down from there, we've got our normal heart protector 6 here, and then heart protector 7 at the wrist that we know already, and then heart protector 8 in the centre of the palm, coming to heart protector 10 on the end of the finger. So that's our heart protector meridian. We've then got, coming into heart, so it's the other side of the cubital crease, we've got heart 3. So with the fire meridian, especially the yin ones, we want to be quite tender with. They're much more sort of linked to emotion, and also they're on this kind of more softer side of the limb. So heart 3 is, again, it's quite a releasing point, but it's more kind of about releasing emotional issues. So we're going to work it a bit more carefully. Then we come down and we've got our heart 7 that we know about already, heart 8 in the palm, coming off heart 9 on the little finger. So you'll probably remember before this kind of fire hold in the hand, we've got heart 8 and heart protector 8, and this is a nice hold when we do our massage. So what I'm going to move on to now is doing the treatment and doing the massage aspect. I'm just using a bit more of the Arnica Intense sort of lotion because it's got a nice glide to it. So I'm going to start with doing that kind of pushing movement through, and as you go by you can pay attention to any of the points. So on the yang side I'm working a bit more vigorously, and then on the yin side, so you could, depending on how your arm is rested, you can use both hands. Or so this is warming up and allowing you to feel what the meridians are feeling like. We've also got our rolling movement where we use the ulnar edge of the hand, and this just really starts to simulate, especially on this yang side, this kind of outside aspect, and you'll start to see as things start to redden up, that's where there's stagnant qi and blood. So that's kind of a good sign for us to see where things are quite stagnant, and we're going to want to release them, and you'll definitely get that with any stiffness and pain through the arm. On the yin side, circling is a bit more gentle. Then we're going to palm through our meridians. I'm holding now triple heater 10, triple heater 5. So starting with making a connection really helps the energy flow in the meridian and helps me get my location. Then I'm doing quite slow, can either use the edge of the thumb or the thumb pad, and I'm doing quite slow, precise movements, tracing the line of the meridian. Again, it doesn't totally matter what direction you're working in. It's nice with some meridians to work in a certain direction. This does flow downwards, but you're not going to change the flow of the meridian. It's more about your comfort and, again, intuition. So reworking down that several times, coming off the ring finger. Now, as this flows down through the carpal tunnel aspect, this often gets really tight with any wrist strain, carpal tunnel, or could be if the body's fighting off a pathogen. So we're doing this cross release. We can work really firmly here, and this really releases the tissues, releases all the fascia through the forearm, often gets tight with working a lot, using your phone quite a lot. Then this triple heater, large intestine and lung meridians get really sort of quite stagnant. So that's often the best move to release that one, the cross release. Then coming through to my small intestine, so finding small intestine 8. Now I could hold that as long as the hand's nice and supported and palm down. So it doesn't totally, it's not strict how you do it, it's about whether you find a good location and you feel supported. If you're holding a point and working at the same time, you've got a good linking happening, which allows you to tune into the key more. When we link areas, we also allow the person's body to tune into that meridian. So then I'm coming down. This definitely feels a bit more depleted than the triple heater did. Coming down, holding 3, which is a really major point, coming off the finger. Then I'm moving to large intestine. So again, I can find my large intestine point here, work large intestine 10. Now this is definitely the fullest meridian, and it'll be a bit uncomfortable for my client here because it's quite tight. But again, any pain in the arm, or again could be letting go issues, but it often comes up with arm pain or immunity issues. So I'm already feeling it's tight, so I'm working a bit more firmly, but I can work all the way down. I'm going to work large intestine 4 because that's a really good release point, and come off the finger. Then on these ones, this twist and tweak, the kind of grabbing and tweaking movement, is a really good, you can just see already how it's really releasing stagnant qi and blood through that area. So we can release and work that. You could do the cross stretches, but I really find this angle of the arm and large intestine, this technique is one of the most effective. And we can also soothe and rub over, but you can really see where the qi is releasing through there. Now we're moving on to our yin meridians, and again we're going to be a little bit more soft with the yin meridians, but the lung is a bit more robust than when we come to the heart protector and heart. So lung 5. Now definitely the metal element was probably the fullest that was seen to be coming up in the meridians, so lung 5 still feels quite full, but not as much as large intestine. So I'd think that was something more linked to the large intestine meridian. I'm going to work lung 5. And then kind of come down, and as you come down you're seeing how does that feel. So you're going to do that 3 or 4 times and really listen in with your touch. And I'm going to, on lung, rather than, you can do a tweak, just we can see just with the structure of the arm that doesn't work as well, but often this firm thumb movements, it's almost like thumb walking. Often they used to describe it as that sort of thumb meditation technique. Even though it's quicker than we would really think, it's because you need to be really aware. So having all your focus awareness in the end of your thumb, so you're really feeling what's going on with the energy. Coming off the lung, moving on to heart protector, again now being a little bit more gentle. Heart protector 3, heart protector 6, I'm making a nice connection. And with this one you can use your thumb. Often I find it comfortable just to use my hand and palm down. So I'm being kind of comforting and slow. This one, coming down, you can switch when you come further down. And you can just see also that this is a little bit more, Kyo needs a little bit more, so it's softer, it's a bit more depleted. And then I'm holding heart protector 7 on the wrist, heart protector 8, coming off the middle finger. So then coming to heart, I'm going to work heart 3. And then again, this nice comforting way of working so that I'm actually tuning into the kind of soft energy. So definitely I would say heart is definitely a little bit lower in energy, whereas large intestine had a bit more energy in it. So I'm just going to work them differently. Obviously they're yin and yang meridians, so they'll feel different as well. But we had heart 3 and then heart 7. So heart 7 is a really nice tonifying point. So I'm going to hold heart 7 and heart 8. And with the intention of really supporting and tonifying that energy. And your client will often drift at this point, and their breathing will get a bit deeper. Coming off the little finger, and then you can always go back, you can do more of those movements, also incorporate a lot of lovely handwork, remembering a lot of energy gets stuck in the joints, so you can do all your joint mobilizations and a lot of circling around the joints to free up any stuck qi. And then remember that kind of twist and pull off of the fingers, that tweener technique. I'm doing that a lot more gently. So I don't want to kind of pull and click the fingers because I want this to be really relaxing as well. So you can do that kind of pull or a softer pull. And again, I can end with that fire hold, which I would definitely with this client, or if lung was quite depleted, you can end with a lung hold, where you put my palm of my hand onto their lung area of their reflexes and hold lung 9.